So thank you so much. Thanks for being here. And now I think after this introduction and thanking you everyone, I'm happy to introduce Ramon Maspons. Ramon Maspons will be our first speaker today. He's the Chief Innovation Officer at Aquas and also the Chief Health Innovation Strategist at the Ministry of Health at the Government of Catalonia. Ramon has more than 10 years experience in hospital and medical innovation and more than 15 years experience in European projects. So Ramon will give a first introduction. So please, Ramon, the floor is yours.
Hello, everybody. Happy to be here. Can you hear me? Yes, okay. Thank you. First of all, as Maria pointed out, thanks everybody for the flexibility for joining virtually today. Because of this emergency situation, we have had to change our plans, but I'm sure everybody agree that clearly this change and this online meeting demonstrates and show us that the commitment and the resilience of this project and of this consortium. So happy to join everybody online. Just few words in order to share with you some ideas. First of all, this unexpected change of the event reflects one of the main strengths of our healthcare systems, the resilience and the ability to adapt quickly and continue to move forward even in difficult circumstances and with difficult environment. So pleasure to welcome you to RaDAR-PPI event today. RaDAR, it's clearly an initiative that show how innovation can help us, can become a true driver of the transformation of the healthcare sector. Our healthcare sector, not only in Catalonia, overall, is undergoing a big transformation, a profound transformation, increasing complex challenge related with aging population, related with chronic disease, related with workforce reductions, related with climate change. So clearly focus on looking for greater efficiency, sustainability, and of course, one of the main threats is related with antimicrobial resistance, AMR. For sure, at least from our point of view, this transformation is not optional, it's a must. And we want to ensure if we want to ensure a resilient and high quality healthcare systems, it means that we have to focus on patients. So with all this environment, with all this situation, with all these changes in our healthcare sector, it's clear for us, at least in the last years, and from our experience, that PPIs, public procurement of innovation, is emerging as one of the most strategic and powerful tools. We are not talking longer about procuring better, we are talking about procuring to transform. So PPI allows us as public sector, as public procurer, to act driving innovation through identification of real system needs, creating demand for solutions that are not previously available in the market. This acceleration of technological development reduces the time to adoption and to offer clinical solutions, organizational pathways, and to create social value. With all this approach, for sure, AMR is one of the main critical areas. It's one of the main serious global health problems, one of the main global health threats, because finally it compromises treatments, prolongs hospitals stays, increase healthcare costs, and most important, put patient lives at risk. The ability to detect rapidly, accurately, and efficiently is critical at the end. So it's one of the main threats for our healthcare systems, and all related with increasing control and prevention is one of the main challenge for our institutions. So RaDAR-PPI is clearly focusing these points. Through this cross-border collaboration, the project launched some years ago, clearly a message to try to identify advanced solutions for this rapid detection of AMRs, and for sure is providing us with new technologies and, of course, giving us the possibility to have a replicable model based on needs assessment, institutional cooperation, cross-border approach, and this dialogue quietly structured with market. With all these issues, at least from our experience, RaDAR-PPI is providing us points related with accelerating innovation in a very important clinical area for our healthcare sector, giving us the possibility to bridge the gap between healthcare needs and technological solutions, foster increased collaborations between and among healthcare institutions, and finally, to contribute to prepare our healthcare system in a more resilient and value-driven way. So, with all of this, today we have the possibility, unfortunately, to meet not face-to-face, but virtually, to share all this experience with all the stakeholders, to point out, to reaffirm our strategy for transforming healthcare sector based on collaboration, innovation, and public leadership. And just for ending, I'd like to thank European Commission, all the institutions involved, professionals, and all the partners involved in the consortium, and a special recognition for course for Enric Limon as one of the leaderships, at least in Catalonia, of all these issues and the Aquas teams. And thank you everybody for being part of this journey with us for a more innovative, resilient, and sustainable healthcare systems. So welcome back and wish you an inspiring and not windy event. Thank you everybody. So Maria, the floor is yours.
Thanks, Ramon, for your words, and indeed, we hope we can see each other again in person and not in a windy weather soon. I think it was very enlightening. Now we will move to our next